Hey, this is Doc Erik. Welcome to my YouTube neighborhood, the channel where you get one mindset tip and one body set tip, typically rolled into one video. Today we're going to be talking about the 7 principles as it pertains to patellofemoral pain, knee pain, and how to get out of it. So let's go ahead and jump in. I'm very excited about this video. Here we go. So one of the key things to successful rehabilitation protocol in order to get you out of patellofemoral pain or knee pain obviously requires an accurate differential diagnosis. The therapist needs to know exactly what's going on, what you can do and what you can't do, and they don't want to just give you some cookie cutter protocol or program. Once this has been achieved and an accurate diagnosis has been established, you can customize an individualized program with a specific time component as well as goals to initiate and help to promote the normal function of the joint as well as return to active daily life or sport function if you're an athlete. So the first principle that we want to look at is we want to reduce swelling. Swelling causes joint effusion, which basically takes up more space into the joint, and this typically results in a loss of range of motion. It could also lead to painful or limited joint range of motion. So one of the ways to work around this is the therapeutic use of ice if it's required, heat if it's required, or the use of a temporary brace if it's required. Principle number 2 is reducing pain. Pain can play a role in muscle inhibition. When you have pain, the muscle tissue typically doesn't want to work because there's a pain response. If the individual tries to push through this phase, this is going to lead back to that joint effusion or that soft tissue swelling like we talked about in the first phase, the first step. So the use of topicals like creams, like a biofreeze, you can use the application of ice or heat depending upon which is warranted, or also the use of temporary bracing is also allowable in this phase as well. The third phase or principle that we're looking at is establishing muscle activation as well as muscle inhibition. Many times when we're looking at a knee injury, we find that there's an underactivation of the quadriceps muscle, which can lead to instability, so we need to turn this muscle tissue back on. Hamstring activation is typically required at this stage as well in order to get the muscle tissues communicating between one another. So the hamstring and the quadricep muscles have a tethered relationship. One influences the other. Sometimes you'll require activation of one muscle tissue before as well as inhibition of the other muscle tissue, so it's important to know which is which, and that typically comes from advice from your therapist. The fourth principle is the ability to control motion through the knee, through the hip. The knee is an interesting joint because it's basically a hinge joint. It's designed to be a stable joint, and the knee has an influence on what happens below at the ankle as well as above at the hip. So it's kind of that in between. It's the conduit from the ankle to the hip. The knee just happens to be the piece in the middle. So when working with a therapist, you want to make sure that the ankle as well as the hip are assessed, because those are the joints that also need to have integration as well as the knee starts to heal. Stability and strengthening of the muscle tissues of the hip will help to reduce the uneven and unbalanced loading at the knee. And the same can be true at the ankle. We want to make sure that we have proper integration of support at the ankle in order to take some of the pressure off the knee as well. So you can work from above down to the knee, from hip to knee, or you can work below to the top from ankle up to the knee. The fifth principle is enhancing soft tissue flexibility. So we have muscle tissues like the hamstrings, the quadriceps, the hip adductors, the gastroc complex, the glute muscles. If there's an adhesion in any of these muscle tissues, the body won't be able to generate proper motor control or force production from those muscle groups. This could lead to a force compensation from one muscle group to another, which is going to promote a inhibited motor firing pattern, which could be causing some of the knee pain. So it could be a sequencing issue. So in this particular case, you want to target those fibrotic areas to remove those adhesions to allow access to those ranges of motions and muscle tissues so that you can start to train and control them. Principle number 6 is you want to enhance proprioception through neuromuscular control. So that's a mouthful. Basically what that means is you're integrating rehabilitation drills that are advancing from non-weight bearing exercises to weight bearing exercises to increased weight bearing exercises to working with unstable surfaces to working with more weight, more volume, multi-direction exercises, and things like going from single leg drills to double leg drills back to single leg drills. Basically what you're doing is as the tissues start to show progress and the ability to heal, you can start to take them through different ranges of motion that mimic back to return to real life. And the seventh and final principle is the return to active daily living exercises and non-active daily living exercises. So this is a case where you go back to the patient's initial set of concerns and you see if they've improved. So for example, if somebody had issues with walking up a set of stairs but not down a set of stairs through your rehabilitative program, they should be able to go back upstairs pain-free, as well as carrying loads such as, for example, groceries or laundry. If it's somebody who's an athlete, you want them to be able to return to full capacity for their sport. So if they're a high impact athlete like a football player or a basketball player or a soccer player, you want to make sure that they have good control, motor control, function, and endurance, as well as speed and strength of that muscle tissue as they take it through its various range of motions on and off the field, as well as in the weight room itself. So there you have it. Those are the 7 different principles as it pertains to working with the knee. Those are the typical steps that we see in terms of rehabilitative process. So if you're curious about how the heck do you go from pain to out of pain, that's the principle that you typically see. And when you see a therapist, they're going to typically take you through that sequence of events to go from reducing the soft tissue swelling to get you to a pain-free range of motion, to start to integrate and strengthen those muscle tissues, rehabilitating along the way so that eventually you can get back to doing what you love to do. So if you're somebody who's suffering from knee pain, you got a great place to start. So the mindset tip and the body set tip is, if you're somebody who's suffering from knee pain, this is a great backbone in order to kind of establish the baseline of questions that you should be asking your therapist when you choose somebody to help you with your knee pain. And as always, if you like videos like this, don't forget to rate, review, and subscribe. We love getting new YouTube visitors to this channel. It helps me grow the channel and also allows me to answer questions that I receive from online as well as in person. So until next time, stay healthy.